Did you know that approximately 70% of fatal overdoses occurred while people used substances alone? Considering this fact, we propose an innovative, cost effective solution, Naloxone Plus. This solution merges resources that are available today, namely fentanyl testing strips and naloxone kits. We believe that this will increase the use of both of these resources in private residences and thus reduce the number of overdose related deaths in BC.
But first, a bit about ourselves. Our names are Jennifer, Joven, Aria, Rachel, and Luce. We are students and are currently working the front lines of the overdose crisis as research assistants at the Burnaby Center for Mental Health and Addiction and as shelter workers at local homeless shelters. To illustrate the need of a single combined kit, only 11,000 fentanyl testing strips were distributed across British Columbia in 2020, compared to just over 200,000 naloxone kits that were distributed in the same time. Take-home test strips have been demonstrated to increase risk perception across various studies in previous years. For example, after a positive test result, drug users have reported managing their risk better by using with a peer, using at a supervised consumption site, or starting with a lower dose of drug.
You may be wondering, if the Naloxone Plus kit is made available, will it be used? Well, studies have reported there is a high willingness of using fentanyl strips, as they are time efficient and straightforward to use. However, the reason they are currently not being used is due to barriers such as the ability to obtain them. Our hopes are having the Naloxone Plus kit made readily available will eliminate this barrier.